This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
Hey everyone, thanks so much for checking out Health Yeah, your prescription for clear and concise medical health and wellness info. Please subscribe wherever you get your podcasts so you can get a weekly dose. I'm Monica Robbins. While many of you may be waiting for your federal stimulus check, there's another part of the American Rescue Plan that may impact you, especially if you use the federal marketplace for your health insurance. You know, the one you can find at healthcare.gov. Congress included a $34 billion expansion to the plan that applies to those needing Cobra, and they changed subsidies, so there's a chance you may be able to pay less for coverage. I talked with insurance broker Tim McNichols at LIG Solutions to help us figure out what's included. What's the biggest change Ohioans are going to see?
Well, there's two really big things that people are going to see. I think that'll impact them dramatically. One was something that happened before this bill was signed by President Biden. It was the creation of a special enrollment period. And what that means is that if you've been impacted by COVID, which really means anybody, I think in Ohio's, everyone's been impacted by COVID, can qualify to get or change or, get an Obamacare or ACA plan through the federal exchange, which is what we're here in Ohio or use in Ohio is the federal marketplace. And that was significant because normally you can only do that in that November, December timeframe here in Ohio. So this is significant. And that started on February 15th and runs through May 15th. So if you're looking to get coverage, haven't had coverage, or you don't like what you have currently, you can make those changes now. And that actually leads to probably one of the biggest changes that happened because of the American Rescue Plan, and that was the subsidies. Many people have found that in the past they didn't qualify for a subsidy through the ACA or the Obamacare programs because they made too much money, and that was a problem for a lot of people. And it was really a cliff, and it started, where you would reach that level based on your overall income, how many people you had in your family, and then it just stopped. It just dropped down, and there was no subsidies. Now it's more of a gentle roll down. And so the way they have it set up, or if you read anything, it says that, people that make up to 400% of the federal poverty line, and most people don't even understand what that would be, but really it's about $100,000 for a family of four. And again, it's total income, total family income. So all the income sources, those people will now be eligible for subsidies. And even beyond that a little bit, it just, again, depends on your scenario, your age, how many people you have in your family. And that's why we always encourage you to talk to a professional, to find out where you fall into that. And that, along with the fact that we have an SEP or the special enrollment period, is a great time for people to, look at making changes. If you've had a subsidy in the past, you'll probably find that that's increasing. And so you have not a deadline, but as of April 1st, you can actually make adjustments to your subsidies. And so if you've had a subsidy, you'll probably find that you're going to have a higher subsidy, which means you're going to pay less per month. And so it's something where you can either call us here at LIG, or you can actually go to healthcare.gov and make some of those. It's just really, do you want to do it yourself, or do you want to have somebody do it for you and kind of walk you through it? Something that we always encourage. But the really interesting thing is they say about 3.6 million people that haven't had health insurance are going to now qualify to get subsidies. So these are people that just chose not to have it because it was either too expensive or, they didn't want it. And another 9.5 million people nationally will have access to some significant subsidies that haven't had those before. So this is going to impact the majority of the people here in Ohio that have gone to the ACA or have gotten individual coverage. It doesn't really impact people that have group through their employer. But if they start looking at things like HRAs, which are health reimbursement arrangements, and they're going to change from a traditional group plan to an HRA, which is a way to offer health insurance to an employee group that's not your traditional group plan, they're going to be looking at ACA plans. So, something that talking to a professional is a big part of this.
One of the things that I noticed in the last few years prior to President Biden taking over is that a lot of these plans in Ohio, a lot of the insurance companies were just cutting them out, and we had less choice. Has that changed?
Not yet. I mean, the plans that are in place are, they usually do that in the like September, October timeframe for the next coming year. So I think we're going to start seeing more insurance companies coming back into the market. We've heard some of the different larger national carriers are exploring coming back into the market that had pulled out. So I think that's something, and that had already started, even before the new administration took place. It's just something that I think it's time. The markets have leveled off a little bit, the individual market. So I think it's, for a lot of companies, the right time to make some of those changes. So we'll see that for 2022.
In Ohio, how many choices do people have?
Hundreds. I mean, it really depends on where you live at. It's all based on your zip code. So, if you live, in Youngstown, you're going to have different options than what you would in Cleveland or in Akron, potentially, or Columbus or Toledo. So it's based on the carriers that are there. We're fortunate in Ohio that we do have a lot of choices, and that's compared to some other states where they have two or three. We have probably 8 to 10 different carriers in Northeast Ohio, and hundreds of different plans, because you have bronze level plans, silver level plans, gold level plans, and platinum level plans. And it just depends on what kind of coverage you're looking for. And there's some unique things, like here, if you want individual coverage in Northeast Ohio and you want to go to the Cleveland Clinic, Oscar is one of your only choices for that. So you have to understand what hospitals you want to go to, what your doctors are. And that's things that we do here regularly with our members, where we go through and talk about what type of coverage you're looking for, what type of physician networks and hospitals, and even prescription drugs, because that can all impact the choices that you have with the coverage options.
This also impacted Cobra. Can you explain how that works?
Yeah, absolutely. So typically, if you have employer coverage and you've been laid off or you leave involuntarily, you're usually offered Cobra. And Cobra is a continuation of the group coverage that you had through your employer. The only real difference now is that you're paying for it 100%, and there's usually a small fee associated with that. And most people find that that's pretty expensive. It's not affordable for a lot of people, so they hold off on doing it. Typically, you have about 60 days to enroll. And what this new American Rescue Plan did is it will actually allow people that have been offered Cobra to get it basically for free through the federal government. The government's going to subsidize the cost of the Cobra coverage for 6 months. So that'll go up through the end of September. The biggest thing that I would caution people there is look at your options. I mean, Cobra isn't always the best option. You may find, especially with the new subsidies and the fact that we have this special enrollment period going on, that you may actually have better options through the ACA than you would with your Cobra. Big difference there is, like, if you have an ongoing medical condition, Cobra might be your best bet, because you will want to, kind of maintain deductibles and, all those kind of things. But that's where talking to somebody or having that conversation will help to figure out what is your best option.
What about this isn't going to last forever, is it?
No. So the subsidies that they have in place right now are set up for 2 years right now, and that may change. I mean, I think there's a lot of things in play with the Affordable Care Act. It's not really going away, but it's going to be what they're going to do. This was part of the American Rescue Plan. Those types of things, to do a long-term subsidy change, would have to be voted. That would be, Congress, the Senate and the House coming together to make those changes. But for right now, the subsidies will be in place for 2 years. So all of this year and all of 2022, and we'll kind of see where things go from there. The Cobra, obviously, that goes through the end of September. And this SEP that ends here in May, but we'll still have open enrollment at the end of the year like we typically do. So it's a good time to look at your health options if you haven't. It's like anything else. You always want to evaluate what you have, especially with things that have changed recently. You may find that you have better coverage options, but you need to take the time and effort to do the research and find out your options.
If you do choose to take the federal government option with Cobra, can you eventually be taxed on that?
Honestly, I don't know. That, I think, is something that you would have to go through and talk with a trained professional on, but I'm not sure about that.
Okay. Anything else in the American Rescue Plan that affects insurance and what people need to know?
Not really. I mean, those are the biggest things right now. I think, Medicare wasn't dramatically impacted in this. That's kind of status quo with the exception of the fact that there's this open enrollment period. Well, it's really not an open enrollment period. It's a change period. So if you have a current enrolled plan for Medicare, you can make a change through the end of March. So if you found that after January 1, your old plan, your doctor isn't in network anymore or something else has changed with the plan, if you're 65 and over and have Medicare, you can still make a change up through the end of March. And that's really not part of the American Rescue Plan. That's just a normal program. But outside of that, within this American Rescue Plan, the significant stuff is the new subsidy and the Cobra, along with this SEP that's happening.
Are these things that were taken out because of previous administrations and then just put back in, or is this completely new?
This is completely new. The SEP, that's new in itself. I mean, last year you had the ability, if you had a qualifying life event, which is typically a job change, job loss, you've moved, anything significant like that would qualify you to get a new plan. So a lot of people that were impacted in 2020 after, this whole lockdown and shutdown started could get changes, but it was only for those people that had that qualifying life event. So having an SEP, this special enrollment period, was a game changer in that it could be open to anybody and everybody, regardless of your status with jobs or moving or things along those lines. So that's huge. And then the new subsidies, obviously, that's new. That's never been an option before, especially at the rate now where you have a lot larger pool of people that'll qualify for a subsidy. That's unprecedented.
So 3 things you would tell people to do right now.
Check what your insurance coverage is, where you're at with that. If you have a subsidy, look and see where you're at with that. You realistically have had a change there with this new plan. So you want to go either to an organization like ours or go to healthcare.gov and put in your new information and get those new subsidies added in. If you don't have coverage, obviously now is the time to make that change. You'll probably qualify for a subsidy if you fit those income guidelines that you've probably experienced in the past, not having that kind of coverage option available to you. And then if you've had a job loss and you want to keep your current coverage through your employer, that Cobra option through the end of September, you'll be able to get that at no cost through the provisions of the American Rescue Plan. So I think those are the biggest things that you need to look at and figure out what you want to do.
And remind everybody the laws that did change. It's not illegal not to have insurance or you won't be taxed anymore. Is that correct?
Correct. That's still in place. So up through, a few years ago, you had to pay a penalty basically if you didn't carry health insurance. And the previous administration basically changed that to 0. And that's still being fought. I mean, that is, still in the courts and things along those lines. But a lot of it's been put on hold by this administration as they kind of evaluate what all the previous changes that had been made to the Affordable Care Act, and I think they're still waiting to get the Homeland Security individual put in as the kind of the leader of all things related to healthcare. And, once that happens, I think we'll see some of these things either removed or changed, but that's still in question. What'll be the going forward part of that.
Like Tim said, you can do this yourself by going to healthcare.gov or let an insurance broker do it for you. But there's no way in health you want to be Googling for names. In the description, I included a link to the Ohio Department of Insurance licensed agent and agency locator. Follow me at Monica Robbins on Twitter and Instagram, and my Facebook page, Monica Robbins WKYC, to learn about upcoming podcasts and health news and to stay up to date with WKYC.com, their social platforms, and the YouTube channel as well. Stay well and have a healthy week.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.